Welcome to today's lecture. And for today, we'll be doing an overview of what you should be expecting for your next modular training. That is the Module 2. The title of the module is Communication and Interpersonal Skills. My name is Fan McBaquin from Fexen's Health College. For this module, there are four main sections that we'll be discussing. The first section, which is section A, will roughly take us a week to do this section. And this section talks about communication skills. And then an individual's success as an MCA, a medicine counter assistant, begins and ends with the ability to communicate both professionally and also courteously. So a lesson in communication will really going to help you. In fact, under this section, we are going to look deeper into other issues that you should know when you are communicating with other healthcare professionals and also with your patients or your clients. Then we'll talk about section B. Section B will also roughly take us about 2 lectures, and we are going to talk about conflict and conflict resolution. Conflicts are inevitable. Inevitable means that it's difficult for us to avoid it. Conflict will always come. And basically, conflict is a disagreement between one or more people. Now, the MCA should learn and develop the skills of handling it in a fair and sensible manner. At the end of the day, when there are conflicts that behold at the pharmacy, we should be able to handle this conflict in such a way that the pharmacy is going to be productive. Then we'll look at section C, which talks about customer care. Now, service, especially in customer service, is about providing a friendly welcome for all of our customers. We need to make sure that our customers are well informed, and a lot of times the customers should get the best out of what they want. So customer service is essential, especially in the provision of our work as a medicine counter assistant. Then we'll talk about the last section, which is section D. And this section talks about the psychology of the patient. As an MCA, you'll be faced with clients with different behaviors and emotions. Understanding the psyche of these patients will go a long way in helping them in difficult situations. And most often than not, when they come to the pharmacy, we are supposed to be able to help them. Now, under the customer service, there are basically about 6 or 7 topics that we'll be discussing. All right. The first one, we're going to look at communication in healthcare systems. Now, the way we communicate in the healthcare is very important, because if you don't communicate very well, it can bring a lot of issues. So when you start these lessons, you are going to look at what is communication, the communication cycle, factors to consider when you are communicating. What are some of the things you are supposed to respect when you are communicating, both the verbal and the non-verbal communication. Non-verbal is what we don't say, gestures. The way we look at our customers, the way we stand, the way we sit. We are also going to look at verbal communication, pronunciations of terms and stuff. All right, so under the communication in the healthcare system, those are the issues we'll be discussing. And then we'll move to barriers to communication. And this is important for us to know, because there are lots of things that can affect the communication between an MCA and the client, or an MCA and your boss, or an MCA and a colleague. For example, if you have an elderly patient, as you can see, and this patient have gotten a hearing impairment, they are not able to hear you very well. That could serve as a barrier, or the language you are speaking they don't understand, or they are visually impaired. So we'll be discussing into details these barriers, and this is very important for us to know in the pharmacy, where there's a barrier and what to do to overcome the barrier. If not, and you give a medicine to a patient and you are not able to communicate very well to this patient, it can be very disastrous. Then we look at good communication skills, and under good communication skills, we are going to look at how we can speak very well. So we are going to look at our speaking skills. We are also going to look at our non-verbal skills, gestures. How do we use our hand, our eyes, all those things in communicating. We are going to look at questioning skills. How do we ask questions? The type of questions that we are supposed to ask the patient. Okay, for example, the yes and no questions, we call them the closed questions, and the open questions. Okay, how are you? What are you feeling? How are you feeling? And all those stuff. Okay, so under good communication skills, we look at the speaking skills, we look at your questioning skills, we look at also your listening skills. Okay, and these are factors that can help you to communicate very well as a medicine's counter assistant. Then we come to the dangers of poor communication. I think you know. In fact, in the pharmacy, if you don't communicate very well, one of the dangers is that patients may easily take an overdose of their medicine. They may not listen to you properly, and that can cause a lot of problems. Okay, we've had problems where patients have come to buy medicines they are supposed to apply on their skin, like calamine lotion. And because there was a poor communication, this patient ended up drinking the calamine lotion, and you can imagine what really happened to the patient. So in the pharmacy, if you communicate poorly, you put the life and the risks and the risks of losing our license in practicing. All right, so it's essential we learn how to communicate well so that we can avoid poor communication. Then we look at relating to other pharmacy staff or teamwork. Okay, and under that pharmacy and teamwork, communication is important because we work as a team. The way we communicate should be as a team. Assuming you are in the pharmacy and the patient comes with a complaint or something, you don't say that it wasn't you, so you're not able to help and communicating. And the last one, look at how do we communicate with other patients, okay, other people. So these are the topics we'll be discussing under communication. Possibly the next time we meet, that's what we are going to be discussing on communication. When we are through with communication, as we always do, there will be a quiz on communication, and it's going to be an online based quiz as we have started already. Okay, so once the lecture on communication is over, okay, the quiz portal will be open for you to go and take the quiz on communication. We are not going to be sending assignments as we used to do. The quiz is simple and you get your marks readily. Then we also have section B, and section B talks about conflict and conflict resolution. And as I've said earlier, conflicts are inevitable. Okay, a disagreement between you and your boss, a disagreement between you and your patient, a disagreement between you and your colleague is inevitable. It's bound to happen. All right, so we are going to be discussing what causes this conflict. What are some of the causes? Okay, under this lesson, that's what we'll be looking at. And it's important for us to know the causes of conflict because it's going to happen. Sometimes over limited resources, it could be a calculator or a pen. You can have MCs fighting over. Okay, and how do we classify conflicts? Okay, based on the personal conflicts, group conflicts, and intra-individual conflicts. Then we look at the wrong approach to managing conflicts. In fact, we are going to discuss this one so that we don't use any. All right, some people, for example, are firecrackers. Once you do anything they disagree with, they'll tell you their mind. Okay, as people say, I can't, in some way, they'll just tell you their mind and go their way. That's not the way we work at the pharmacy. Okay, so we are going to look at the wrong approach so that we avoid it. It's something that will destroy morale in the pharmacy, will not help people, will not help you, and will not help anybody. And the last lecture is going to be managing conflicts rightly. What are the right steps you use to manage conflict? If somebody disagrees with you, how you're supposed to handle it. All right. And that's going to be the last lesson on conflict and conflict resolution. Then after this, as I've said too, there'll be a quiz online. I'll ask you to take the quiz on conflict and conflict resolution. And I'm expecting all of you to have a pass, at least to be able to progress to section C. Under section C, we are also going to be discussing a lecture on customer care. Okay, customer care. Most time people say customer service. We look at what is customer service. Okay, and this lecture is going to tell us this service people provide at the pharmacy. For a client to be happy with the service you have provided, we have to plan and prepare for it. Okay, it doesn't happen out of the blue. Okay, so why is customer service so important? And here to discuss that customer service now is a competitive tool. A customer may choose one pharmacy over the other, not because one is well stocked than the other, but because of the nice service that that pharmacy is giving them. Then we look at how to promote good customer service. In fact, customer service is key if you know. Okay, how do we provide good customer service? Then we look at customer complaints. Okay, why do customers complain? And what are the types of complaints customers will come with? how do we handle customer complaints. So under customer complaints, we discuss into details and how we handle customer complaint, how we are supposed to see customer complaints. A lot of time when a customer complains, some people may see that the customer is worrying. Okay, but normally when we learn customers complaints, they are great benefit to the business. It helps the pharmacy to improve greatly. The last topic that we're going to discuss under customer care is service recovery. Basically, service recovery talks about what do you do when things go wrong. Okay, what do we do when we accidentally give the customer a wrong medicine? Okay, so that's what we call service recovery. How do we recover the service? Your customer is annoyed because we did a mistake. How do we recover the service? All right. So under customer service, these are the lessons we'll be learning. And when we finish the section C on customer service too, I'll post the quiz on our online platform, and I recommend that you take that quiz to help you better understand. Then we talk about our last session in module 2, and that is going to be a topic on the psychology of the patient. The psychology of the patient. Now, basically, we are supposed to understand the patient into details because the patient is very complex. Okay, when somebody is healthy, the way they will behave with you when they come to the pharmacy is different from when they are confused. Assuming somebody goes to the hospital and the person is not sure whether they have a cancer or not, okay, the way they behave is different. And if they have been diagnosed of having cancer, the way they will behave to you is different. So you can have a patient that was very lovely and friendly with you in the pharmacy. All of a sudden, this patient changed completely. Okay, we don't say that the patient is over pampered or the patient is attention seeking, but we are supposed to understand what is happening and how the patient is thinking. All right, so that's going to be the psyche of the ill person. We look at the health behaviors in all. We are also going to look at stages of illness experience. When somebody does not feel well, what are the stages they go through? Okay, and as I've said, all these lessons are supposed to let you understand the behaviors these patients will exhibit when they come to the pharmacy. When we are done with the psyche of the ill person, we come to talk about grieving. Normally, when patients lose close relatives, friends, okay, they grieve. And when they come to the pharmacy, we are supposed to empathize with them. Okay, and we can only empathize when we understand grieving and the grieving process. Then we also look at mourning and bereavement. They are still under grieving. Okay, mourning is quite personal. Bereavement is what they do for everybody to see that they have lost somebody or someone very close to them. Okay. Then we're going to learn about the stages of grief. Okay, the dangers of grieving and all those things, and how do we help patients in such difficult situations. So basically, when it comes to psychology of the patient, this is what we'll also be looking at. It's a lovely lecture. It has helped me. I know it's going to help you in your practice. It's going to make you key and caring and have empathy on patient. Okay, when a client loses their baby and they come to the pharmacy and they are buying medicine, when their baby is in the intensive care unit, all right, and they come and they are disoriented, we don't shout at them. We empathize with them. We encourage them and we give them hope. That is the type of practice that we are expecting all of you, MCs, to exhibit. Okay, people have said that pharmacists and sometimes doctors and nurses, we are very cold to our patients because we don't show any form of emotion when they lost or when they lose their close relatives. All right, and that is why we are supposed to do the psychology of the patient. All right, so these are the 4 sections, and after this one too, there will be a quiz. Okay, after this one, so there are going to be 4 quizzes under this section, under this model too. Okay, one is going to be on the first one, that's communication. The second will be on conflict management. The third will be on customer service. And the fourth will be on the psychology of the patient. After we are done with the 4 quizzes that I've talked about under section A, B, C, and D, then we take one exam on the module 2. Okay, and that is going to be online. And as I've said, because of the current issues we are having, a lot of our lectures will be online. And I hope by the time we finish the module 2, the government was going to allow us to come and meet, and we'll show you how we'll be meeting. All right, God bless you all. As I said, my name is Farman, but if you don't understand anything, you can WhatsApp me on my personal line, and I know you all have it. You can send me a WhatsApp. By the next time we meet, I'll be starting the lecture completely on communication in the pharmacy. Thank you and have a lovely day. Bye bye.